9:15, and we have a special guest in the studio this morning. Please welcome to Radio 1, Dr. Omar Fattal, who's from the Lebanese Medical Association for Sexual Health. Welcome to Radio 1. Very nice to see you up here in St. Mary.
Thank you.
Hi, Doctor.
You refused my offer of an espresso. Is it too much for you first thing in the morning coffee?
Yeah, it's too strong.
Okay. So anyway, welcome to the studios. And at the moment, it's LGBT Health Week. So a health week, especially for lesbian, gay, bisexual and transgender people. Why do they need their own health week?
Right, because LGBT people in Lebanon have been marginalized and subject to stigma and lots of myth and taboos for a long period of time. And we, as an organization, believe that we need to raise awareness about this issue, specifically the relationship between marginalization and the effects, negative effects on health of LGBT people. We believe that awareness is the first step towards any change.
Marginalization puts them more at risk for health problems.
Correct.
Yeah.
Why is that?
Because there are certain things that are affected. Like, for example, if you take the example of HIV and STDs, criminalization of homosexuality in Lebanon, and taboo surrounding sexuality in general and specifically homosexuality makes it very difficult for people to raise awareness campaigns or
admit that they themselves are gay or whatever because of legal fear and socially to be marginalized.
Exactly. We know, for example, in the case of HIV, the very first step is to get tested, and that's the most important thing. But then if you're afraid that your doctor is going to break confidentiality and tell your family that you're gay, for example, or if you're terrified that someone's going to report you and you're going to end up in jail.
Because this still exists in Lebanon, the possibility of getting arrested or getting in trouble legally for being reported as a homosexual.
Yeah, correct. But also I think the issue of confidentiality and taboo and stigma is much more pronounced, and there's lack of guarantee of confidentiality in many places.
But can doctors do that? Can doctors report you for being gay if you go there and you...
Technically in Lebanon, anyone can report you, actually, whether it's a doctor, a neighbor, anyone can report you, and that's enough to be arrested just based on status. You don't even have to be practicing
or doing anything wrong in the moment, yeah.
Yeah.
So what's the point of this promotion? I mean, how can this help?
So the idea is we are addressing three different components. We are talking to the public, and we're talking to the media, we're talking to healthcare professionals directly. And we think that each one of these groups has a different responsibility, has a different interest in this subject. So if you're a healthcare provider, which is the main focus for us, then this is going to translate into better services for LGBT people that's more direct, and we have done a lot of activities about that. So Saturday and Sunday we were at St. Joseph University and the AUB holding workshops all day for healthcare professionals to train them.
Just making them more aware of this issue, so they know maybe to be more careful, to be more secretive about these situations, I guess. Yeah.
Yeah, exactly. To maintain confidentiality and to teach them more about these.
Or to teach them to ask the questions that they need to ask, maybe, because I don't think like a lot of them come out and say it to the doctor. Maybe they'll wait to be asked, or. Yeah, because I've gone with a couple of my friends who are gay to the doctors, and we've had this issue. Yeah, but usually like we get nice doctors. The doctor would ask, and take the patient aside and treat the issue with respect. Yeah.
What areas in health are affected the most for LGBT?
Yeah, so in relationship to marginalization, we think that the three areas and the ones that have the most research and studies behind them are HIV and other STDs, mental health, and access to care.
Okay.
What about access to care? What do you mean they don't have access to care? Just that they wouldn't want to go in the first place?
Yeah, I mean, maybe I can give you a very small story that, if someone who reported to LebMASH that he was gay and he went to see an infectious disease doctor, and because he had an infection, skin infection, but she immediately was convinced that he has HIV, and she asked him for an HIV test, and she almost convinced him that he was HIV positive.
Oh my God, the horror.
Just because he said that he was gay, but then he did not have any risk factors. He told her he had only one partner. He practiced safe sex. But she stigmatized him basically, and that's an example of how he never went back to see her to get the care that he needed. And then when other people hear about these kind of stories, then they become much more hesitant to seek care because they don't want to be subjected to discrimination or bad treatment just because they are who they are.
Understandable.
So it's Dr. Omar Fattal from LebMASH. It's the Lebanese Medical Association for Sexual Health. How can we get more details on this?
So we have a link for this specific week. It's lebmash.org/health week, and it has all the information, and it's going to have videos later today that are made for this campaign specifically. They're awareness videos as well.
I wanted to ask you one last thing about the testing, where people can find places to test themselves in a safe, secretive way, I guess, links to maybe somewhere they can go.
Yeah, thanks for that question. We have the information on the link as well, but mainly MRSA is a great place to go, and SCDC is doing a great job with testing. So those would be the two main places, and phone numbers and websites are on our link.
And how important is it to get tested? Like, it's very important.
Everyone
right?
needs to be tested, whether you're gay, straight, bisexual, everyone should be tested.
Definitely.
They're sexually active.
Definitely.
So it's Health Week for the LGBT community. Dr. Omar Fattal from LebMASH, thank you for coming in this morning.
Thank you.